Hello. This week I wanted to actually talk about some of the interventions and kind of therapy techniques that I use with my clients. So just to go over it really quick, so I work with clients who are recently discharged from a behavioral health unit. We work with them for 1 month. And during that 1 month, there's a lot of opportunity for us to provide brief interventions, short-term therapy, and it's all done virtually. So we'll call them, check in on them, make sure they're taking their medications, and then also we will, like I said, do the therapy part. So, um, so it starts off with when they leave the behavioral health unit, they complete an M3, which helps diagnose or look for depression, bipolar, anxiety related disorders. So specifically today, I'm going to talk about some of the anxiety related disorders, how I work with those clients. Um, so, for example, one tool I use is if a client calls and, for example, they say, I have a test coming up for school, I'm not going to pass, I'm going to fail, and it's making them extremely upset. So I'll kind of put that thought on trial in a sense. I'll tell them, well, what's the absolute worst case scenario that'll happen? Then they'll say it, and then usually when they say that, they kind of end up laughing because it seems so ridiculous. And then I'll say, okay, so what's the best scenario that can happen? And then I kind of have them find like a happy median. So that kind of puts their thoughts on trial a little bit, looks at the evidence, really kind of helps them question their own thoughts and help them see how those irrational thoughts aren't actually true. I have a couple of printouts that I use with my clients. Another one I have is it's called the Introduction to Anxiety. So while I'm on the conversation with a client, if they seem anxious, they seem like they're worried about a lot going on, I'll ask them, what are 3 things that trigger you? Have them list them or say them out loud. I'll ask them, what are their symptoms? Are they getting tight chest, shortness of breath, sweaty palms? Um, I'll ask them, what are 3 thoughts you tend to have when you feel anxious? And then what are things that you do to cope when you're anxious? So I feel like that kind of gives me the opportunity to see how the client deals with their anxiety and different coping mechanisms that they have, and then ultimately allow me to work with them to further develop those skills. Another good one that I have is mindfulness. So I will have clients, I'll do deep breathing with them over the phone, have them hold in for 4 seconds. I'll count for them and then they'll relax and let out the air. I find that calms them down. I'll also do some grounding techniques, and some visual techniques. So if a client calls me once again, they're extremely anxious. I'll say, what do you see around you? What are some objects that you see? One time I had a lady say, she's sitting in her kitchen and she mentioned a picture. And then I said, well, what do you see in the picture? So then she said, it's one of my family members, blah, blah, blah. So then I asked her, tell me about that family member. So that really helped distract her from, the anxious feelings that she was going in. It popped her bubble and she was able to talk about a family member. We talked about that for 5 minutes. And by the end of the conversation, her immediate intense anxiety was gone. So I find that really helps. Another good one is if you ask a client, what do they smell? And the reason why I like that is because it actually requires them to take a breath. Usually they'll, pause, take a breath. So it also incorporates deep breathing. So I think that one's a great one. I use that a lot. Another one, yeah, I go over healthy and unhealthy coping skills. I go over the importance of not using drugs or alcohol, to watch their caffeine intake, overeating, self-harm, aggression. I also like to help the clients monitor their sleep, because I know how important sleep is to a client. I want to make sure they're not getting too much or too little. So I'll ask them questions, are you having trouble falling asleep, staying asleep? Are you sleeping too much, too little? I've even had clients develop a sleeping journal that's helped them track their sleeping patterns over time, which a lot of them have found to be super helpful. I'm just looking more at some of the sheets that I use. Another good one that I work with clients is on cognitive distortions. So one of the example would be catastrophizing, which I kind of said earlier. It's only seeing one way, or the worst possible outcome of a situation. I explained some techniques that I use with that, having them explain the worst case scenario, best case scenario, and then finding a happy medium. Jumping to conclusion, a lot of clients I have do that. So I think there's lots of techniques that us as social workers can use with our clients. I seem to enjoy the clients who have anxiety disorders because I feel like I'm most familiar with those techniques to use. But like I said, there's so many techniques out there. You guys can do lots of research on this. A really good website is called Therapist Aid. They have a bunch of anxiety worksheets, depression worksheets. They have OCD worksheets. Um, a lot about mindfulness and the importance of that. So I highly recommend that website. And thanks for listening. Okay, bye.